Good morning. Carotid triangle. Carotid triangle is one of the subdivisions of anterior triangle of the neck. It is so called because it contains three major carotid arteries, that is common carotid artery, external carotid artery and internal carotid artery. Boundaries. Superiorly, it is bounded by posterior belly of digastric along with stylohyoid. Antero-inferiorly, it is formed by superior belly of omohyoid. Posteriorly, it is formed by the anterior margin of the sternocleidomastoid muscle. So this is a carotid triangle with the three boundaries. Roof. The roof is formed by skin, superficial fascia, platysma, the subcutaneous muscle, cervical branch of facial nerve which supplies the platysma, transverse cutaneous nerve of neck, and the last one is investing layer of deep cervical fascia. So these are the structures which forms the roof of the carotid triangle. Floor. The floor of the carotid triangle is formed by middle constrictor of pharynx, inferior constrictor of pharynx, hyoglossus and thyrohyoid. So these are the muscles which forms the floor of the carotid triangle. Contents. The contents of the carotid triangle are: number 1, common carotid artery with carotid sinus and carotid body. See, this is the common carotid artery. You can see the dilatation of the or bulging of the artery, that is known as the carotid sinus, and between the two terminal branches of the carotid artery you can see a bud-like or swelling like structure, that is the carotid body. So common carotid artery, carotid sinus and carotid body. So that is the first content. Number 2, internal carotid artery. Number 3, external carotid artery and its first 5 branches, which include superior thyroid artery, lingual artery, facial artery, ascending pharyngeal artery and occipital artery. Number 3, internal jugular vein and its tributaries. Number 4, last 3 cranial nerves, that is 10th, 11th and 12th cranial nerves. Last 3 cranial nerves, that is 10th, 11th and 12th cranial nerves. See, this is the 10th cranial nerve or vagus nerve. This is the 11th cranial nerve, spinal part of accessory nerve, and this is the 12th cranial nerve, hypoglossal nerve. Next one is ansa cervicalis. You can see the loop of the nerve forming the ansa cervicalis. Next one is deep cervical lymph nodes. Deep cervical lymph nodes. So these are the deep cervical lymph nodes. And sympathetic chain. Finally, the carotid artery, the internal jugular vein and the vagus nerve are covered by a sheath known as carotid sheath. So these are the contents of carotid triangle. So once I will repeat. Number 1, carotid artery, carotid sinus, carotid body. Number 2, internal carotid artery. Number 3, external carotid artery with its first 5 branches. Number 4, 3 cranial nerves, that is the last 3 cranial nerves. 10th, 11th and 12th cranial nerves. Internal jugular vein and its tributaries. Ansa cervicalis, deep cervical lymph nodes, sympathetic chain, and finally the carotid sheath. Clinical anatomy. Carotid sinus syndrome. In individuals with hypersensitivity carotid sinuses, pressure on the carotid sinus due to wearing of shirt with tight collar or tie can compress the carotid sinus and it may cause slowing of heart rate. This condition is known as carotid sinus syndrome. Pulsation of carotid artery. The carotid artery pulse can be felt in the carotid triangle by pressing medially and posteriorly on the carotid tubercle. The carotid tubercle is nothing but the anterior tubercle of the transverse process of 6th cervical vertebra, which lies 4 cm above the sternoclavicular joint. So just above 4 cm above the sternoclavicular joint, you can feel the carotid tubercle. Okay, compressing the carotid artery against the tubercle, you can feel the pulsation of the carotid artery. Thank you.